right, so let's see here. I want to show you guys. Oh, Dorothy, I have one more here. Here you go.
Oh yeah, this is me. The reason I sent this in was because when I first started the program, I did the biohealth stool test and it came out clear. But I've been really frustrated with my digestion, so I did the GI, not the MAP. I did the cheaper one, the GI pathogen, and you see how it came up.
Is that the most beautiful thing in the world? Look at that.
And I knew it. I knew there was something going on.
I get so happy when I see it. And you have H. pylori too.
Yeah.
Oh man, that's like, to me, this is like Christmas when I see this. This is like, oh, what a gift. You're going to get so much better. So a couple questions that'll come up, right? One is that the virulence factors indicate how much the H. pylori is damaging your system, and if one or both of these is positive, then it's considered a somewhat more urgent matter to treat H. pylori. However, my personal opinion is I just get rid of H. pylori whenever I see it, even if there's it just seems to be worthwhile for most people that I work with. So I would encourage you to probably treat it even though the virulence factors are normal, and even though maybe there's not a sense of urgency about it. And then the Giardia explains a lot, and that's a hard one to kill. You should think about medications. I'm not saying you have to do drugs for it, but I would consider medications.
Yeah, and I think I've possibly had it for several years. I went to visit my daughter when she was in the Peace Corps in Armenia, and I got sick. I did get sick, and I know they have a lot of Giardia there.
How sick were you?
Well, I just had, it was a limited diarrhea, like traveler's diarrhea, but I didn't treat it. I just felt like I got better, but.
Yeah, so you may have just picked it up, and now it's been a nagging problem,
Yeah, I think that's possible.
So tinidazole, iodoxin, there's a bunch of different medications for it. Some people even use Alinea. I don't think you have to treat Giardia with medications, but I definitely consider it as an option,
Do the medication, then maybe do some more herbs.
Usually it's hard enough to get rid of that getting the medications in first, and then following it up with the herbs is a pretty good call. There's also usually a fairly large amount of rebound yeast overgrowth and just other bad gut stuff happening with Giardia. I don't think this lab necessarily picked up on all those things, but so there's usually plenty of room to work with the herbs after the primary infection's treated, unless for some reason the patient or it's just got a really strong reason not to use medications. Some people do. They've been on antibiotics their whole life for acne or something like that, or they just, there's some reason why you want to avoid it. But something to consider because it's pretty hard to kill. And you got the H. pylori too, which it doesn't sound like you have tons of H. pylori problems. There's not an ulcer or stomach pain, correct?
No, and I've never had heartburn, anything like that.
Okay, so then this one would almost certainly be treated with herbs because the antibiotics for H. pylori, it's 2 weeks of a Prev pack, and no one wants to do that unless they have to. So you're already kind of stuck probably with herbs here. So trying to do herbal protocols for both of these is just, for most people, it's kind of overwhelming.
Okay.
Just so much stuff for so long, people don't follow through. But Giardia really makes people tired. Have you been tired lately?
Well, I mean, I guess so.
It'll be interesting to see.
Yeah, maybe it'll boost my energy. I'm not a super high energy person, so it hasn't like weighed me down or anything. It's kind of my normal, but I would love to have more energy. It would be great.
Okay, yeah. I mean, that almost always happens with Giardia. The other thing that happens with Giardia is, it really covers the lining of the small intestine, so nutrient absorption just takes a hit pretty bad. Well, that's kind of exciting. So this is a good argument for doing additional testing, right? Just to see.
Yeah, and I'm glad I did it. I'm glad I got frustrated enough to finally do it.
Yeah, and it's a lesson too for all of us with patients. You run a test like a 418, it comes back normal. You still suspect something. Totally fine to do another test. I mean, I really push people to do that and just tell a patient, hey, if I was an orthopedist and we did an x-ray of your neck and they didn't see anything and you still had incredible neck pain, we do an MRI. You know, we just do another study and trying to find out what's going on. It's reasonable to keep testing people until you figure it out. Totally reasonable. It's not like a clear test, especially with the stool testing, is going to settle the issue necessarily. Yeah.
All right.
Is that good on that?
Yeah, that's great. Thank you.
Okay. Oh, you bet.